There's not one of us that does not look in the mirror and go like this.
53-year-old Mary Stecker is working a little harder to put her best face forward. She's a salesperson and is always looking for an advantage to close a deal.
I've had Botox. I've had my whole forehead is Botox in the middle of my eyebrows all the way up.
It's moving though.
Yes, I don't want to look frozen. I'm not a Stefford wife. I want to move.
Just a little collagen for her thinning, creasing lips.
My lips were always thin. I didn't want to all of a sudden make big lips for myself.
Latisse is keeping her lashes and brows long and thick, but she still sees something more in the mirror she wants to fix.
At the beginning of the summer, my arms were flapping in the wind.
And as the skin is starting to get looser...
To that, plastic surgeon Paul Glatt could have recommended liposuction.
If we have to do surgery, we do it. But we've got great new technology out that's coming out every month.
Push off the left foot.
But for Mary's flappy arms, the doctor simply ordered the specialist down the hall.
Big muscles to small muscles. Doing the abs last.
And 3 months later...
Separate your feet a little.
I don't want to be perfect.
Lock it up.
But now I can wear short sleeves and I feel comfortable wearing them.
All the way down, elbows to knees.
Mary isn't the only mature woman uncomfortable with the sags and bags that come in the so-called golden years.
That's really making a big difference for someone.
Dr. Glatt is seeing more moms and grandmoms sick of their aging baby bellies and all those other dips and dimples.
A lot of it's, women who've had children and careers and put kids through college, and now it's their time.
I don't want to go over the top. I just wanted to look like myself, the best I can look.
And that means going under the needle to soften some of these deep lines around Mary's nose and mouth.
Get right in this, what they call the marionette area, right at the corner of the mouth and below. We want to try to fill this area in.
That needle hurts at first until the anesthesia included in the filler, Radiesse, kicks in.
And that'll help to smooth it out. Now I want to do this pre-jowl area and kind of just try to camouflage this around your jawline.
Done in about 15 minutes. Mary looks a little red and puffy.
What's going to happen here where we see, is that just swelling from the...
That's like where the needle was inserted, so sometimes you'll get a little bump from that, and a lot of times we'll just have the patient, we do a little bit of massaging just to try to smooth it out, because it really is almost like putty in the beginning. And then the patient can do that for the first day or two as well, and that usually just gets rid of that.
Here's Mary before and after. For $1,100, the first treatment should last a full year. She has cut way back on some of the luxuries of life to keep up her looks, shopping and eating out less, and scaled back vacations. It's her choice.
53, okay? The way that I look, it's important to me. Yes, eat in. There's so many, come on, this is America. There's so many ways that if you want something, you can get it. Just cut back a little bit on something else.
Cutting on her face is where Mary draws the line.
Well, you know what, right now, I don't think I would do a facelift. And I think that as time goes on, by the time I'm 60, I'll bet you there's something that I don't have to.
Now, of course, not everything is for everybody, but here's about what Mary shells out on her beauty boosters. $360 on Latisse lashes and brows, $600 for the Botox forehead, and $1,100 on Radiesse wrinkles and folds. Close to $2,000 a year, and even less, she says, when she catches a special offer at a doctor's office. And yes, there are makeover financing plans available. Joyce Evans, Fox 29 News.